So one way of articulating the left sacroiliac joint here is to hold down the sacrum. So really hold it between your hand and the table, okay? And then find the PSIS, which is here. Place the PSIS in the palm of your hand between the two thenas, just here. Hold the sacrum down into the table. Find the PSIS with your palm of your hand, and by holding the sacrum still with my right hand, I can produce a shearing force through the actual sacroiliac joint. Now I'm altering the angle, as you can see, that I am producing the shearing movement so that I can actually articulate the joint itself. So remember, here's the sacrum, here's the innominate bone, and it's this angle. So if we show you on this side, it's this angle here, not straight down. So let's just do that one more time. Take up the slack, hold the sacrum down, find the PSIS, which is right here. There's that knuckle shape there. Place that PSIS here. So my knuckle is like that. And then I'm just pushing with my body weight through my arm at different angles to find the right joint angle for this left sacroiliac joint. One of the features of osteopathic techniques is that they are both a treatment technique and can also be an examination technique. So I'm just going to show you a way of shearing the joint. So remember, you've got your sacrum here where my hand is. Okay, we'll just make it flat at the top. All right, you've got your ilium bone or the innominate bone attached to form the sacroiliac joint here. Now remember, the plane of the joint is not this, it's actually like that, all right? So to actually stress the joint, to see if pain is coming from that area, you need to apply a slight force, comfortable force, all right, at an angle, not straight down to the table. So a way of doing that, find your posterior superior iliac spine. So here, quite easy to find. So there it is there, and I'm going to place my left hand on the sacrum and just lean down and push it and keep it attached to the table. I don't want the sacrum to move. Then, with the palm of my hand between the two thenas, just here, I'm going to place the left posterior superior iliac spine there. So the posterior superior iliac spine, like my knuckle, is sitting like that. Okay, so first of all, you must hold on to the sacrum, push it into the table so it doesn't move. I'm going to place my right hand now with the posterior superior iliac spine sitting between the two thenas here, like that. Okay, now if I make sure the sacrum doesn't move and I push by leaning forward and not using my shoulder, so all I'm doing is leaning forward through my arm, I'm actually exerting a force in this direction. It's a comfortable force, it's not aggressive, all right? And this will shear the joint. So if we go back to the ilium and the sacrum, my hand is here, and we're actually producing a force that is a shearing force through the sacroiliac joint. Now, two things. If it's really inflamed, it will reproduce the symptoms. So your client will go, gosh, that's the pain I get. If it's hypomobile, i.e. quite rigid and needs a little bit of loosening up, you could use the same technique as an articulation. Now remember, the joint angle is not exact. So to get a good shearing force, you need to alter the position of your hand like I'm doing to find the optimum joint angle. Now the optimum joint angle you will find because it will start to give a little bit, or in the case of it being inflamed and dysfunctional, your client will say, at that point will say, I can now feel the pain that I get. So let's just do that one more time. Hand on the sacrum, forcing it into the table so it doesn't move. Okay, skin's not moving, the skin is now tight. Place the PSIS in between the thenas. There's the PSIS there. Okay, find your angle. All right, so my hand is moving a little bit in different directions, and there's the optimum angle right now. So I'm now shearing the left sacroiliac joint.